Welcome to History of Health Information Technology in the U.S., Evolution of Health IT, the Early Years. This is Lecture A, Introduction and Pre-1970. There have been many changes in both healthcare and health information technology over the past 50 years. This unit and those that follow will explore the background to the increased interest in health IT, or health information technology, that we are seeing today. Health IT usually refers to electronic health records and other clinical computing applications used in the care of patients. It may also refer to other types of systems used in hospitals and physicians' offices, such as those used for billing and scheduling patients. The objectives for this lecture, Introduction and Pre-1970, are to discuss the enduring values that have been foci for HIT stakeholders from the perspectives of healthcare organizations, community and practicing physicians, and academic physicians, information systems personnel, and medical informaticians. Discuss how the social, educational, and professional environments in healthcare influence these values. Discuss the impact of key developments in the 1950s and 60s, including Sputnik, Medicare and Medicaid legislation, medical research, and the civil rights legislation on healthcare. Describe the characteristics of the healthcare environment and the use of computers in healthcare in the 50s and 60s. Many of you who are familiar with the use of information technology in other areas outside healthcare may be asking, what has taken so long, and why does there appear to be a sudden interest now? By the time you finish these units on the evolution of health IT, you will understand why. In particular, we will look at the variety of factors that, when combined, have led to the present focus on healthcare IT, and by understanding these factors, we will be able to anticipate future developments. What we are going to do in this series of units is to explore several changes over the period from the 1950s to the present, including looking at the general cultural and social environment in the U.S. and the healthcare environment in particular, and how they have changed. Within healthcare, we will look at several groups, including healthcare organizations, mainly hospitals, and how they have changed over this time. In terms of professional groups, we will focus on physicians, because physicians are certainly key players in the entire healthcare arena, and also medical school faculty, most of whom are physicians. Finally, we will look at informatics specialists, or informaticians. Early informaticians were typically faculty in health sciences schools who focused their research activities on the application of technology to improve the management of information in healthcare. Those researchers have built many of the health IT applications that are either still used today or formed the foundation of our current electronic health records and other health IT applications. Many of the developers of these informatics applications are also physicians, or at least medical school faculty, and they share many of the same attitudes and values of the other faculty. What we are going to do is look at the influences on each of these groups, as well as their enduring goals, interests, and concerns. Enduring goals are those things that have remained the same even while other things have changed. Over the last 50 years or so, there have been many changes, but for the most part, these core values have remained the same. We will look at these values and use our understanding of them to predict future changes. Let's focus first on the influence patterns among some key elements: the general environment and healthcare environment and healthcare organizations, which together really forms the environment within which the health professionals are practicing. We will also focus on three particular health professionals: physicians, medical school faculty, many of whom are a subset of physicians, and the academic informaticians, who are medical school faculty with a research and development interest in informatics. If we look at these groups, we can see that the general environment affects the healthcare environment, which in turn affects how healthcare organizations function in that environment. Similarly, the values and attitudes of physicians are shared by the physician faculty, and the faculty attitudes are shared by the informaticians, but there are other influences. The healthcare environment directly affects both the physicians who practice in it as well as the medical school faculty. The healthcare organizations in which they work have a specific influence on what each group does, so we can anticipate a lot by looking at the interest of each of these groups. In addition to these general patterns of influence, there are changes over time that impact what's happening. The past influences the present, and the present in turn influences the future, and this is true across all of these different groups. For instance, certain aspects of the way physicians have always practiced in medicine influence today's physicians, who in turn influence future physicians. In addition to the direct influence, there are some special influences that you should be thinking about as we go through this history. The environment of the past, in other words, the world in which individuals grew up and what it was like when they were children, is going to influence them as adults. So that for the children of today who become physicians or members of the IT workforce for that matter, the environment of today will influence how they will be as adult professionals. In addition to general environmental influences, what occurs in the educational environment, in other words, what the medical school faculty is teaching, will influence future physicians. So, what medical school faculty taught in the 1950s and 60s is what influences the senior practicing physicians of today. And what medical school faculty members of today emphasize will influence the physicians of the future. Educational change does not happen very rapidly, so we might expect some changes to begin in the educational settings and only much later become predominant in actual practice. What you will see is that there have been changes in these last two elements, the general environment and what has occurred in medical education, that have affected today's receptivity to the use of information technology. So let's take a look at these enduring interests and concerns of each of these groups. What we will see is that the different individuals, the managers of healthcare organizations who reflect organizational needs, as well as the practicing physicians, the academic physicians, and the academic informaticians, have had different and frequently conflicting interests. Although often criticized for being overly interested in fiscal viability, healthcare organizations obviously need to be financially successful to survive. Therefore, fiscal viability has got to be a key concern. At the same time, healthcare organizations have always been interested in, at the very least, sustaining themselves and also in growing. This does not mean that they or their managers do not care about the patients they serve, but most people would agree that financial maintenance and growth are important in order for healthcare organizations to thrive. Let's now look at physicians. Practicing physicians have emphasized patient care as their primary interest, otherwise they wouldn't be in practice. Also, like other professionals, professional freedom has always been a prime value for physicians. Academic physicians share with other physicians their interest in patient care, but because they have chosen to practice in an academic environment, they have additional interests such as research and teaching. The medical informaticians, like other physicians, are interested in improving patient care, but their interest in computers has led them to focus on computer applications that improve patient care. And because most of the early informatics professionals were academic physicians, they also focused on the more academic and research aspects of computer and information science. Most of the work of these academic informaticians began about 50 years ago, and they began publishing in the late 1960s and 70s. What was going on in the U.S. just prior to the beginning of these developments? Let's take a look at the general environment in the 1950s and 60s. One of the trends was that science was becoming very important. We know that this was the beginning of the era of space exploration. The United States and the Soviet Union were adversaries, and the Russians were the first to launch a satellite called Sputnik in 1957. Some of you have seen the movie October Sky that captured that era. Technology of many kinds was developing, including computers. And there were fears that the Russians would get ahead of us in science education. This led to a huge effort to improve America's science education through increased funding. At about the same time in the mid-1960s, the idea of the Great Society was introduced. This was President Lyndon Johnson's social program where he declared war on poverty. There was also civil rights legislation. The picture shows President Lyndon B. Johnson signing the 1964 Civil Rights Act. Other legislation led to increased access to jobs, education, and most importantly, to health care. We will see that there are parallels in health care to what was happening in the general environment. We saw scientific breakthroughs in healthcare as well. During the 40s and 50s, there were breakthroughs in cures for infectious diseases. The so-called wonder drugs like penicillin were introduced, and there were numerous developments in medical technology. Computers were beginning to be used in the research setting largely for managing data, and in the hospital practice setting for administrative uses. During this time period, hospital administrators usually left the physicians to practice as they chose, and the IT personnel, who were technically but not clinically knowledgeable, focused mainly on supporting the administrative uses of computers. While there were some clinical computing applications being developed by the medical informatics faculty at academic medical centers at this time, these rarely found their way into operational use outside these centers, and actually, even where they were developed, they tended to not be used operationally. Related to the war on poverty, there was also broader insurance coverage, specifically the Medicare and Medicaid legislation. Medicare guaranteed access to care for the elderly, and Medicaid provided access for the poor. So during this time period, we had many more people seeking health care. Medicare legislation allowed physicians and hospitals to be reimbursed for what were called reasonable and customary charges. The broader health insurance coverage led to increased access to care. This can be seen as the equivalent in the healthcare arena to what was going on in the general environment, where there was increased access to both jobs and education. One of the effects of increased access to healthcare and freedom from financial worries about payment was that there was more opportunity for those with chronic diseases to access the healthcare system. This led to concern that there would not be enough physicians to treat the increase in anticipated patients. Projections by a variety of government committees in the late 50s to early 60s indicated that in the future there was going to be a shortage of physicians. These reports had a significant influence on subsequent public policy. You may notice that many of these issues and concerns are similar to those raised about the 2010 healthcare reform legislation, where once again there is more access to care for previously uninsured individuals. One of the differences, though, is in the 1960s there were no electronic health records to address these problems. But beginning around the same time, there were some key developments in the underpinnings of today's electronic health records. This concludes Lecture A, Evolution of Health IT, the Early Years. In summary, prior to 1970, there were several key developments that set the stage for IT advances in the years to come. There was increasing interest in science and science education. In addition, because of civil rights legislation, as well as the establishment of Medicare and Medicaid, we saw overall greater access to both education and health care. In this environment, physicians were able to charge for their services with little government control. At the same time, because of the increased access to health care by new populations, there were concerns about a physician shortage. It's in this setting that the beginning of clinical computer applications began to be developed.